Are you preparing for SCA? Maybe you're not sure what you're doing wrong and you're not getting constructive feedback. In this way, I'm going to share with you an extract of a coaching session. You'll see me providing constructive feedback to a GP trainee. Hope you find it useful. I'll share with you how this could have been done better. I think in the data gathering here, we need more information about the partner and the relationship. How did this relationship start? So what if she started telling you this is a teacher? Now it's going to put different type of risk to that relationship of being abused. Things that you need to make sure you ask would be, how did they meet? So if it's a position of trust, the partner, that's definitely a red flag. The age as well. So it's already like an issue with the age because there's a big difference. Also, I want to make sure I cover whether there's any alcohol involved, any recreational drugs, because that could have affected the way that she started having intercourse. Don't reassure them that everything is confidential in the beginning and then having to walk back from that in the middle of the consultation because it doesn't look very professional and you might lose trust from the patient. So in the beginning, it could be better if you say, everything we'll discuss will be kept within confidentiality, unless if I'm obliged to disclose anything if there's any risk of harm to you. Something like that might be better as a caveat. Probably tell her that I understand that you met at school, and it's important that I tell you the concern I've got. All right, I understand that you're quite happy in the relationship, and there are things that we need to do, especially when somebody's having a relationship where there is possibility of a risk to yourself. That's why I'd like to discuss your case confidentially with one of the leads in the practice who deals with child protection, just to make sure that there's anything that they would recommend, because it's very important that we make an assessment of any risk. So that's how we do it. And if the patient is not consented, then in that case, you can disclose, so you can breach confidentiality and disclose it because there is definitely risk here. And the other thing here is that you might want to follow up, as you did, but there needs to be a reason why, though, because you didn't really specify the reason for following up. So it's probably to have a discussion of the pill and see whether we can put it on your repeat. So confidentiality is really tricky thing. So there is Gilly competence and then Fraser's guidelines. Gilly competence is to see whether the patient is has got capacity to make the decision to have treatment or receive the advice. And then Fraser's guidelines apply more to sexual health and contraception. So we check whether the patient is able to make that decision, and whether it is in the best interest of the patient to have it, and whether the patient cannot be persuaded to tell the parents. And also we make sure that when we're doing that, whether there is any other complication or consequences that might actually lie when we're discussing that. So I have done a case like that in the blueprint. You can go and watch it. Have you found the insights in this video useful so far? If so, you might be interested in SCA Blueprint and mini course. This is a free blueprint that you can get and teaching from myself. Just click the link down the description below and sign up, and you will get a teaching from me every day for the next 7 days. This consultation did not start very well here. I'll show you how it started, and then you can resume from that point. So I'll start it. Hi, thanks for calling, Sarah. I can see that you had blood tests and you had some blood results that you wanted to discuss today. Just to put things in context, can you tell me what was discussed with my colleague when you had the bloods done? It is very difficult, and this is a different type of station where it's more of a counseling, you see. I think in this case, you want to take the lead more, because it looks like the patient is asking a lot of questions, and then you're more there as in answering and saying things a bit general, like you can work on your lifestyle, you can lose weight. The first diagnosis of diabetes on this is really going to have an impact on this patient's life. And education is very important, how you convey that message that this diabetes is likely because of lifestyle things that can be improved. So it's important that you don't have this explanation where it can be a bit confusing, saying things like insulin is not working. You mentioned insulin. Most patients with the diabetes with type 2, they can be treated with a variety of medication and doesn't involve having to have injection of insulin, right? So make it clear so that you readdress this concern and expectation. And then it's helpful to actually look at what's a diet like, what they're eating, and then give specific advice so that you can tailor the management. For example, if she's having a lot of sugary food or high carbs, then explain what would be better instead. If you found this video useful, then I'm sure you're going to get a lot from watching this video. Click the video to watch it. Take care, everybody. Bye-bye.